What does heparin and this box of bratwurst have in common? Easy, pig guts. Yeah, did you know that bratwursts are cased in the intestinal lining of a pig? It really grosses me out, so I take it out of the casing and squish it into a hamburger patty. But heparin is also made, it's extruded from the intestinal lining of pigs. So let's talk about the pharmacology of heparin while I toast my bun and wait for my lunch to be done. So heparin, as you all know, is an anticoagulant, and it works by binding to antithrombin. And when it binds to antithrombin, that allows it to accelerate the inactivation of thrombin. And as we know, then that prevents the conversion of fibrinogen into fibrin. And fibrin is what makes the scaffolding for blood clots to form. And so if we're not giving it the scaffolding, there's nothing to hold together a blood clot. And then that reduces the body's ability to form a clot or grow a clot that they already had. And we give this to patients who are having a myocardial infarction, where they've got a hunk of atherosclerotic plaque that's broken off the inside of a coronary artery, and now the blood is rushing to form a clot where it ripped off that endothelial wall. Or a patient with a pulmonary embolism, or a patient with a DVT. We don't want those clots to get bigger. Now, the pharmacodynamics of it. So when we give it IV, it has immediate effectiveness. It goes to work right away. And when you stop a heparin drip, its half-life is about 30 to 60 minutes. So you'll see it stop having the therapeutic effect within the first hour or two, depending on how high of a dose the patient was on. Now, some things that we need to consider on our patients who are on heparin is it has a renal elimination. So if you have a patient with renal failure, they're not going to be clearing that dose, and it's going to be building up. We also need to watch out and protect our patients for bleeding. Why does it seem like every patient who we start on a heparin drip wants to climb up a ladder and take a header off of it? So even if just a small bonk of the head can cause a subdural hematoma or some kind of bleeding injury. We're also going to watch the coagulation panel on these patients and make sure that we're not overdoing it. And we want to stay in a therapeutic range where we're going to inhibit that clot formation, but we're not going to put them into DIC where they start bleeding from everywhere because they can't form any kind of clots. So there you have it, a little bit of pharmacology on heparin and some facts that maybe you didn't want to know. For the record, mustard and sweet pickles are the best way to enjoy a bratwurst.